Patient Portal, product of New Millennium, Simmons and Grenadine Community College, Division of Arts, Sciences, and General Studies.
Does this ring a bell? For many of us, just the thought of the Milton Gates Memorial Hospital is an instant headache.
Members of the NTRC, judges, competitors, mentors, good morning. I am Michaela.
And I am Akili, and together we are New Millennium. On February 4th, 2004, Mark Zuckerberg shared his idea with the universe, an idea that grew from a Harvard social networking site to a global internet phenomenon, which we all grew to love. And today, both Michaela and I have an idea to share with you as well.
We are proposing the idea of creating a web app which will allow Vincentians the opportunity to schedule appointments and easily access prices of services offered at the hospital. This idea came about from the many unpleasant experiences at the Milton Gates Memorial Hospital. One must be at the hospital very early in the morning to even stand a chance of being attended to. This system is outdated and needs to be in line with the technological trends that exist today.
Our idea seeks to resurrect a Vincentian healthcare system which is based around the hospital from a state of comatose by affording the accessible healthcare in the comfort of your own home. Therefore, this project tagline fits the bill perfectly. Patient Portal, enhancing life, excelling in care.
The government department we chose is the Ministry of Health, Wellness and the Environment. After conducting research, which included interviews with the Chief Medical Officer, Assistant Administrator in the Ministry of Health, and the file clerk at the hospital, we noticed that the health sector lacks a system which can provide efficient services to the general public in a timely manner. It is well known throughout SPG that the service at the hospital is very time-consuming and inefficient.
And we have more problems. Problems with the paper-based system run the gamut. For example, it is difficult to treat a patient with a chronic condition or who is in a life-threatening situation, far from home, meaning out of the country, because the patient is not able to supply the healthcare provider with detailed medical information. A file worker at the hospital informed us that the only online system they have is to search for the number on the patient's file. The rest are paper-based records. She said, and I quote, "Oga, all the help fix the system they don't know is bay work." There is also no guarantee for information backup. Your paper-based records can be destroyed by fire, flood, or they can even be stolen. Unless the doctor has made copies of every paper in the filing cabinet, that part of your medical history is lost.
Our hypothesis was services provided at the hospital takes way too long. Then we looked at a possible solution to curb the problem.
Solution: create a web app that is going to shorten the time taken for the general public to retrieve services at the hospital. This will be a secure online link between the patient and hospital, which allows for the scheduling of appointments, access of medical information, including medications, information required for different procedures, as well as a pre-admission guide.
Here is a snippet of what the pre-admission guide would look like. Do we see the patient portal extinguishing the current system?
No. Many hospitals elsewhere have online services at their patients' disposal, but still endorse walk-ins or last-minute appointments. This is a system we hope to achieve. The patient portal is a way of having an appointment process via an application online to help the long existing process be significantly reduced. It will also allow all Vincentians the flexibility as they will be able to make appointments from their devices anywhere, anytime.
Our target market is the general public, which includes doctors, nurses, and administrative personnel at the hospital.
Now, with the implementation of any project, there will be costs added. The government will lose money upon implementation, but in the long run, there will be an economic turnover. Administrative personnel and staff will need training. The purchasing of a main server to maintain the work of the system and other IT facilities, a storage medium for mass storage product backup, and a cloud device. Consultancy services will be required to educate the staff, an approximate cost of $2,000 US, and a programmer costing $2,500 US. Perhaps there may be one or two computers available on site, which patients can be directed and instructed to using.
However, in last week's Searchlight newspaper, both Mrs. Llewellyn Spratt and Mr. Bala of the Ministry of Health held talks with a medical team from Taiwan, and it was revealed that Mr. Bala did receive some training as it relates to health information systems. So right there, some of the costs stated above can be significantly reduced.
To accommodate individuals who are visually impaired, the option to have the information read to them will cater to their needs. This involves a voice recognition system which will be able to interpret spoken words entered by the customer and a speech synthesis mechanism which will be able to respond to a given instruction once a certain condition is met. So basically, it is going to cost the government new efforts.
You think?
No, we're just kidding.
Our patient portal will really help to improve the environment. By removing paper from any process, this is going to benefit the environment.
The web application reduces the number of persons who are deterred by the inefficiency of the healthcare system and encourages more people to come to the hospital to have services done. More technology will be incorporated into the health service procedures as we live in the information age, but our healthcare is stuck in the Stone Age.
Better support for adults caring for aging parents, especially those doing so from far away. They can more easily review material made available by their parents' doctor, discuss medical choices, and monitor the parents' compliance with a course of treatment.
There will be less paper and ink used, an automatic increase in revenue, a reduction of the number of persons who are deterred by the time-consuming and inefficient present system will without a doubt increase the government's revenue. Also, a charge of $5 US yearly can be given to the customers or upkeep of the system.
Firstly, the idea is not in place in theory or practice in SVG, and it is obviously different from anything that is present now. The web app can also be adopted by other government agencies that do not offer online services.
In conclusion, our idea will help the Ministry of Health, Wellness and the Environment to achieve its vision statement. Remember, patient portal, enhancing life, excelling in care.
Resulting in a happy, healthier, sinless and communities.
Thank you.
Hi, good morning. Okay. In your presentation, you had mentioned that when you spoke to, I'm not sure if it was the admin person, but you spoke to somebody there, and they would have mentioned that there is a system, and all that system does is produce the file number for the file?
Yes, it gives the number on the patient's file.
Okay, did you inquire more about that particular system, or you just took their word for it?
No, they would have to go into the paper-based file and find your record.
No, I'm talking about the system the person referred to, that they told you would only generate the file for that. Did you inquire more about that particular system?
Yes, that's as far as the system goes. We wanted to make sure that our idea wasn't already in place,
Okay.
and we found out that that is as far as they go.
Okay. So from the newspaper clipping that you got with Mr. Bala, what exactly was he referring to?
They wanted to implement some modules that are used in Taiwan now. Things like surgery and HIV/AIDS recovery modules.
You said introduce in modules. Where is he placing those modules?
In the hospital. But according to him, as he said, these modules need to be revised and tested before they're implemented, so it will take a while.
Okay. I asked this question because there's a health information system presently in place for a couple of years now, and Mr. Bala happens to be one of the administrators on it, and that's why he was talking about introducing modules. So I just wanted to hear, because probably the administrator or whoever you spoke with isn't utilizing the system properly. Who knows? But my next question is, you also mentioned that the system you are proposing will be able to give medical information. That's correct?
Yeah.
Okay. Who has access to that medical information?
Like we said, right? With the paper-based system, anyone could actually get into it, like any nurse who could misuse it. So now we just have the doctors, any medical person who actually has to interact with the patient. This would be like, okay, they sign in, they send the information to the patient. It's like they interact with the patient back and
information
forth.
on it, can I go on to the system and get
But
information?
each patient will have their individual login account. But there should be a link between the Ministry of Health and the site itself.
No, I was gonna ask about the health information system and what is the plan that you have to link your system and that? Have you found out, do you know what the health information system is?
Yes.
What is it?
It's
From your best now.
a website that it makes the information available
To
to the customer, to the patient.
the health information system is a system that they have that allows doctors, no matter where you are in a institution, to have patient information. You understand?
Yes.
So isn't that a similar system to what you're proposing?
No, it's enhanced because we are.
Well, I was asking you, what,
How would you
How is it
connected, because you can't
enhanced?
bring in a new system.
How would you enhance it?
Right. So we're proposing the patients to be able to pay for services online. We thought that upon investigation, when we went down there, we realized that the lines down there too long. You're going to pay for service, you have to do this, go here, go that, bring all of this thing, come back the next day, wait.
What is the average
So,
rate at the hospital?
what is the average wait? Sometimes you're there, you have to go there early in the morning. When they're ready to call your name, you're lucky if you get through in the morning, you might have to go in the afternoon. They might say come back another day. Because for certain services offered, there's a time limit. And doctors usually see a certain amount of people sometimes on a given day. So we propose the idea of you paying for these services online.
Okay, and we also, on the site, because we started thinking about what the site would look like on the site, you can have a calendar, you go in, and you see what days you want, the procedure that you want is available for the specific doctor. So you go and you book it for that time and you pay.
Also, an added feature would be to have voice recognition and speech synthesis involved, which it would be time consuming. It wouldn't just happen one time. So that is an added feature which could be implemented in the website.
Good question, wait a minute. Kind of a lead on from, yes, I really wanted to get this in because you were talking about improved efficiency, right? I'm assuming that you've done a very good analysis of what exists. Do you have in your mind, if this idea is implemented, just give me a percentage efficiency improvement factor? But how well would you improve the system? By how much will you cut down wait time and so on? Percentage by you.
I think it would be at least 50.
Because
So you're gonna have the wait.
Because the thing about it, we're giving them the choice, right? If we're doing payments online, not everybody has access to a credit card or PayPal account in which they could pay for the service online. So there will always be people still coming there physically to wait. But the individuals will be significantly reduced, I believe, because if you have the option to do it, to save time, you will use it.
also if you already paid and you have your receipt, you just go down, you present it, and you go and have the service done. So those persons who are going to be waiting in line will actually be cut out.
So you're saying about 50%. You have that, you reduce it by,
I say at least 50.
yeah. Okay, that's one. So you got a feel for that.
Thank you, Millennium.